Hi there. The concept of brain balance and an understanding of left or right brain hemisphere dominance or deficiency is becoming increasingly well known in modern societies, especially when discussing childhood development and children's mental health. However, though attention may be focused on the treatment of children with mental, social, or other developmental difficulties, the fact of the matter is that brain balance or imbalance affects adults as well as children and may significantly impact daily life. In this, imbalances that start during the developmental stages of a person's early life can carry through to adulthood. Simply put, a pre-existing childhood hemisphericity imbalance can tend to continue or even grow over time. To understand this further, we must begin within the foundation of what a lot of us already know. As we know, the brain is composed of two hemispheres, the right brain and the left brain, which in an ideal situation they will function together and communicate in a synchronicity that unifies the body. You might also know that throughout our childhood, our brain develops, and in an ideal situation, our two hemispheres will develop equally, thus creating a state of overall balance that will result in equal communication between the left and right brain. In an explanation of this, Dr. Jeremy Fritz, a chiropractic neurologist, explained that when the two sides of the brain share information and communicate equally, the brain and therefore the body will operate efficiently. As such, in order to function well, we should all have relatively balanced strength on each side of the brain, though unfortunately research is showing that this is not always the case for every individual. In this, if there is a developmental imbalance in the brain, if the two hemispheres are out of sync, things that may have previously seemed effortless may now become challenging, and life may become unbalanced. Functional disorders may begin to present themselves. An imbalance such as this between the two hemispheres of our brain is known as functional disconnection syndrome, which is described as a desynchronized state of the brain and is caused by an electrical imbalance between the two hemispheres, which consequently results in a lack of communication between the left and the right brain. Dr. Fritz says that in the instance of disturbed communication between the left and the right hemispheres, the brain will automatically process information through whichever is the dominant side of the brain, meaning that the opposite side, the deficient side of the brain, will then present with conditions and patterns of the functions that are attributed to it, to the involved deficient hemisphere. Furthermore, if an imbalance starts from an early age, the dominant side of the brain will mature and develop faster than the deficient side, which in the long term will cause the existing disconnection between the two hemispheres to widen further. In discussion of the conditions and patterns that may begin to present in a case of hemisphericity imbalance, we must first delve into discussion of the right and left brain and their functions in both our development and our life. The right hemisphere of our brain is responsible for our coordination and our social development. This is our emotional side and is interested in reading, body language, and facial expression. It is in control of our emotional intelligence and empathy. The right brain can see the big picture view of the world and struggles to view individual pieces. In this, it can see the whole forest but not the trees. To expand upon this, we must also include that the right brain is in charge of movement in our big muscles. As such, it controls posture and gait. Furthermore, The right brain controls our balance and controls our ability to know where we are in space, our sense of proprioception. As such, people with right brain hemisphere deficiencies will often present with poor muscle tone, poor posture due to poor tone of the larger muscles near the spine, odd gait, and in children, delayed development of motor skills, appearing with symptoms of poor balance or coordination. Furthermore, in children, right brain deficiencies might present with poor attention and inappropriate behavior or emotional response, such as outbursts of anger. Equally important is the fact that the right brain controls the immune system. In this, the right brain inhibits and prevents the immune system from overreacting and also controls our most life-supporting autonomic reactions. As such, autoimmune conditions such as asthma and allergies often occur in a right brain deficiency due to the fact that the right brain cannot suppress the immune system, leading to inflammation in the body and the brain. Due to this, right brain deficiency can often be diagnosed as conditions such as ADHD, Asperger's, autism, obsessive compulsive disorders, developmental coordination disorder, nonverbal learning disorder, and conduct disorder. In contrast, the left hemisphere of our brain is our intellectual side, our linear brain, our literal understanding. It controls our logic, attention to details, and likes routines and religion. The left hemisphere is the verbal side of our brain and processes everything to do with language, including reading, writing, and speaking. Our left brain sees the world in small pieces. It ignores the whole and concentrates on the individual details. It is good at pattern recognition and systemizing. Similar to our right brain, the left hemisphere also helps to control the immune system. It activates to fight off infections and toxins, stimulating development of lymph tissues. And as such, people with left brain deficiencies are usually prone to chronic infections such as colds and ear infections. Furthermore, the left brain controls the small muscles in our fine motor skills. However, this makes cases of left brain deficiency potentially more difficult to notice than incidents of right brain deficiency. Indeed, symptoms may go unnoticed until school years, when a child with left brain deficiency may appear shy and withdrawn. Often, these children will have poor language skills and not like to talk a lot, or they may have trouble with their speech and they may be hard to verbally understand. Emotionally, people with left brain imbalances can tend to become overwhelmed due to being extremely in touch with their feelings, and are often people who are hyper aware of the way they are seen and judged in the world. With all of the above in mind, left brain deficiencies are often diagnosed as conditions of dyslexia, processing disorders, dysgraphia, which is poor handwriting, language disorders, eating disorders, reading disorders, and poor calculating skills, and selective mutism. Thank you very much for listening. If you are feeling disconnected or unbalanced, or even if you are simply interested in learning more about brain balance and disconnection syndrome, both me, Dr. Shalom, and Dr. Emma would be pleased to speak to you and discuss your interest and questions further. Thank you very much.